Welcome back, everyone. What an incredible day it's been so far. I'm excited to now present our much anticipated closing panel titled Meaningful Engagement, Partnering with Persons with Lived and Living Experience in Quality Improvement, and moderated by Danielle Martin. Danielle is the Director of Clinical Programs at the Mental Health and Addiction Center of Excellence in Ontario Health. In this role, Danielle and her team, in collaboration with clinical experts and persons with lived and living experience, are responsible for developing and the adoption of clinical performance standards, guidelines, and best practices, along with the associated performance metrics for the mental health and addiction sector. Danielle has been with the Center of Excellence since its inception, and before that, she supported other provincial quality improvement programs at Ontario Health. Prior to joining Ontario Health, Danielle worked with primary care teams and organizations across the province to improve quality and patient safety using data and quality improvement techniques. I will now hand things over to Danielle to introduce our panelists.
Great. Thank you so much, Eleni, for that introduction. And I'll just say that I am thrilled to be moderating the discussion for today. I'd like to start off by introducing our panelists. So we have four fantastic panelists who are going to be joining us for this discussion. Madeline Luvisa, Dean Valentine, Dan Bolton, and Carrie Crawford are going to chat with us over the next little while as we work through this very important topic. This panel discussion is meant to showcase the significant impact and value of incorporating the expertise and perspectives of persons with lived and living experience along with their support networks in quality improvement initiatives. We are also going to delve into strategies for meaningful engagement to help advance quality and improved outcomes for clients receiving mental health and addictions care in Ontario. In preparation for this session, I've had a chance to connect with Dean and Madeline and Carrie and Dan over the past couple of weeks, and I will just say that I think we're going to have a great session. We have a few set questions that we are going to ask to get things going, but we have tried to carve out a little bit of time at the end for an open Q&A. So you should see a Q&A function at the bottom of your Zoom window. So if you've got any questions that you'd like us to direct to the panelists, just add those to the Q&A as we go, and we'll try to get to as many of them as we can. But with that, I think we will jump in and get started. And so our first question, and Dan, I think I'm going to turn this one over to you first. But maybe just a good one to get us started is why is it important to include the voices and expertise of persons with lived and living experience and their support networks, so including people like family and friends and caregivers, when undertaking quality improvement activities?
Hello, everybody. Thank you for letting me speak today about my favorite topic, that is finding solutions for my peers in the field that are experiencing homelessness and addiction. The reason now, just right off the bat, the reason why it's so important to have people that have been through it, and I've been through it, and I'm a family member and I'm a caregiver. And why is it so important to have us is if we look at stigma, stigma is based on myths about a group of people. And in order to undo that stigma, those people need, instead of being marginalized and excommunicated, they need to be embraced, brought back in professional support. They need to be listened to. They need to be made part of the solution. And if we look at history, some of the great peoples and groups that have overcome stigma, you would see that for the indigenous people to have a voice, and I use them because 40% of our group is Indigenous, and for women to have a voice, and I use that because 40% of our group are women. Until you start hearing from the people that are actually suffering from the trauma and the stigma and the discrimination, prejudice, the injury that's going on to their group is being ignored. Their group is being stigmatized. It's just building on all the bad stuff that's not working. And all of a sudden we can get things that work really fast because we get advocates that are from that group. They look out for each other. They care for each other. They come up with great theories for themselves, and then they can present those theories. That's exactly what we did to we put our theories together. COVID came and we got scared because, and first of all, we are a group of people that are experiencing homelessness and addiction for many years, justice system trauma, and and I'm one of them. But I'm in recovery. On my first day of recovery, I went out to work with them and stayed with them this entire 7 years. And then COVID came, and that changed our world. All of a sudden, we didn't want to be inside buildings. We didn't want to get stuck in a congregate setting like the nursing homes. We wanted to look and think for ourselves what was going on and how to stand up in our community, present ourselves well during this emergency state. And so, yes, every one of my peers are very special and intelligent and wonderful in every way. It's a great honor to work with them. But it was also circumstantial. And we walked outside the doors of PSNE in St. Thomas and we said, we're not going back inside. We're going to do everything outside from now on. It was safer for us. And our first thought was everything's upside down. This is all backwards. If we do truly have a medical condition, we want our medical condition to be, we want to be treated like other people with other medical conditions. We weren't. We were being treated the opposite of everyone else. So that's my big thing is that we can stop that trauma from stigma. Thank you.
Great. Thanks so much for those comments, Dan, and also for being the one to kick us off. Carrie, I think maybe I'll turn it over to you next. Do you have any kind of thoughts or comments or anything you'd want to build on from what Dan said about why is it important to include the voices and expertise of people with lived and living experience?
Yeah, I'll start by saying thanks for having me today, and it's a pleasure to share some of my thoughts, and I'm going to probably share a little bit of my story as I answer some of the questions today. But for me, it's important to include the voices and expertise of those with lived experience because it creates the connections with the individuals who are sharing their personal journey, and it allows others to think about being in their situation. I think it can help to develop ideas and compassion and gain a deeper understanding and then guide them to find better solutions. So imagine being told that your child has a critical illness and then finding out that they are too young for any of the existing programs to help them. And that's what happened to me in 2015 when my oldest daughter was diagnosed with anorexia nervosa at the age of 10. And at that time, they felt having her on an eating disorder unit would be too traumatizing. And all of the outpatient programs at the time had an age limit of 13 and over. So she spent some time on a medicine floor, and then we did our best working with her eating disorder team to try and manage her illness at home. Then in 2018, we were shocked when our youngest daughter was also diagnosed with anorexia nervosa. And she went from being a completely healthy 12-year-old athlete who loved playing hockey, eating ice cream, pizza, candy, to an emaciated shell of herself. Not only did my daughters waste away physically, but they also wasted away mentally. One became very depressed, quiet, and withdrawn, and my other outgoing, bubbly, soon-to-be teenager disappeared, and in her place was a lethargic, angry stranger. And if you're lucky enough to reach weight restoration, it can still take years before you see any cognitive improvements. So in the past 8 years, we have battled through bulimia nervosa, depression, suicidal ideation, self-harm, body dysmorphia, severe anxiety. And along with that came 9 admissions, one with both my girls being admitted at the same time, 2 of them being over 4 months long, residential treatment 4 hours away, 4 attempts at day programs, a partial hospitalization program, and more therapists and appointments than I can even count. Being able to share my insight and knowing some of the roadblocks that other people may face, I think it can be valuable information to help improve the development of processes. I feel it's an opportunity to get better results in less time and by doing less work with the goal of making things less stressful for future patients, caregivers, and providers. In the end, having my voice heard can help improve some of the challenges I encountered, improving outcomes or experiences for those to follow. And personally, I also feel like it's something positive that can come from something negative.
Thanks so much for that, Carrie. You know, I think with Dan's point as well, this idea of this unique insight that someone who is delivering the service, they may not always see see what those experiences look like from the other side. Madeline, I don't know if did you want to weigh in on this topic as well?
Yeah, I'm not sure that I can say anything that hasn't already been said by the other two panelists, but I echo their thoughts for sure. I think that people with lived experience bring a creativity, a curiosity, and an innovation to the way that things are done in mental health systems, that is just super necessary for us to pull into those spaces, and into those conversations and decisions. And I actually think that that creativity and that innovation can be contagious. So by having people with lived experience join you in those spaces and those decision-making processes, I think that it can help service providers and system leaders gain a comprehensive understanding of the gaps that exist in care, and opportunities or strategies for improvement that they may not have thought of otherwise. The perspectives that people with lived experience bring aren't always accessible within professional or system-oriented spaces. We can't assume that we have every perspective represented with those that are already in the room. I also think that people have a right to participate in the decisions that are made about when, where, how, and why they get to access mental health and substance use care. And I do think that we see better care outcomes when the people with those legitimate experiences, the people who are seeking support to try to address their experiences and their needs, are involved in terms of telling the organizations and the systems what they need and how they need it. I think we see better outcomes across the board, when folks are able to. It's not just about using their voices, but we talk about creating that change. People that experience are a force to be reckoned with when it comes to creating change in systems. And I know on a personal level, when it comes to the importance of including voices, and perspectives of people with experience, it fundamentally changed my life. My first experience with engagement work was I begrudgingly followed a friend of mine to a community event. I did not want to go, but she was too anxious to go alone, and I agreed to support her. And from that day, somebody who was facilitating that community conversation, they came to sit with us and they came to tell us more about the project. They invited us to participate in the development of the agenda for that next meeting. The rest was history, as they say. From there, we were involved in nearly every part of the process. We helped plan for and facilitate meetings. We debriefed about the feedback that we'd received. We decided on next steps together. Our ideas and feedback were taken seriously and incorporated into the work in a timely and tangible way. And so from there, I was able to connect to different committees, different projects. And before I knew it, I had a number of years of experience with engagement, where I was using my voice and sharing my experiences in spaces and with people who played key roles in how service users experience the mental health system, but didn't necessarily always get to hear their experiences directly. I think it's important to remember that the opportunities you create for people that experience to be involved in this work, it takes work. It's not effortless, but it's also incredibly worth it because it legitimately changes lives. It supports learning and growth, confidence and skill building. It helps improve system navigation experiences. I know that once I understood how the system worked better, I knew how to navigate the system more effectively. And for someone like me, it just helps regain access to a part of yourself that you may not have been able to connect with for quite a long time. So I'll stop there.
Yeah, that it's I really like the idea of this of like curiosity and innovation, and both you and Carrie kind of touched on this idea of what it can mean to you as an individual, but also again this contribution to helping the system and the people who operate within it better understand how to make improvements. Dean, did you want to weigh in?
Certainly, thanks, and I'm really thankful to have the opportunity to be here. So, what I would say, I guess, is what hasn't already been mentioned or emphasized really clearly is relationships are important, and I think with including people with lived and living experience, we look at relationships, and the best teacher, I think, is our own experience. So when we look to the experience of ourselves, both kind of successes and challenges, if we can share those with people who are making decisions in the community, I think it's a two-way street where those initiatives and the programs and services that are delivered, you can guarantee that that's the need of the community. And you can see that there may be creative ways to come to solutions. And for me, I kind of think that that experience kind of creates a space where you clearly understand what the real needs of the community are. For me, I think my involvement in community really has to do with engaging in a lot of different sectors, but it's in a way where I can share my experience, uh, successes and challenges, I say sometimes to ensure that others have better experiences or they have the same successes. So I really want to kind of concentrate, I think, a lot has been said, and some great points is that we can establish those relationships. And I think also that if you have lived and living experience within the process, you have more likelihood that you're going to gain acceptance of the initiatives you plan and that they're going to be widely received by the community because the community will see that they have part of those decisions. So I think that is your best success is by ensuring that you have wide acceptance and that all stakeholders have been involved. And I think lived experience is one of the most important.
Great. Thanks everybody for that kind of kickoff question to help us make, um, I think probably a lot of the folks on this line, this question of, why is it important is probably not a foreign question to them. I think everyone here probably inherently knows the value of that, but really understanding the nuance of why it might be important and kind of approaching that question from a different way is important for our understanding. Madeline, I'm going to turn to you for the next question. So when we were doing our preparation calls, we had a really good discussion about engagement. And one of the things that struck me as we were chatting for a few minutes was this question of, well, what exactly do we mean by meaningful engagement? And so maybe the question that I'll turn to you, Madeline, if you want to weigh in on is, when we think about meaningful engagement of people with lived and living experience in their support networks, what exactly does that mean? So what does it entail to do meaningful engagement?
I don't think meaningful looks like any one particular thing. What's meaningful depends on the individuals or the communities you're engaging with, the spaces in which you're engaging with them, the project or initiative at hand, so on and so forth. For me personally, meaningful engagement has always been about feeling like the people that are inviting me into the work are being authentic and transparent. I want to know that the people that I'm sharing my experiences with have a genuine interest in creating change and will be honest with me about what they can do with my ideas and feedback and what they can't. I also draw meaning from engagement opportunities, like I previously mentioned, that give me the chance to learn something. So how the system works is a really critical piece of learning for me in engagement work. Industry terminology or jargon, facilitation and leadership skills. I'm actually also not just a participant in engagement, but I work as an engagement facilitator, and that wouldn't have been possible had I not had my had my roots in participating in those processes. And I think also learning about other people's experiences and perspectives, which is why diversity in these processes is so critical. You there's a million ways for people to experience the mental health system and for people to navigate it and what kinds of needs they might have. And I think that we really need to invite a diversity of perspectives and people into these engagement spaces to make sure that we're learning with and from each other. Similarly, working with me, not for me. I one of the worst engagement experiences I ever had was we would have a meeting, and I hesitate to call it engagement because it didn't feel like that. We would have meetings, and they'd ask questions, and they'd take notes, and then they'd go away for a month, and then they'd come back with more questions and take more notes, and then go away, and it just felt so disingenuous because what was happening with my feedback? There was no follow up. There was no telling us what was happening. We didn't have any say in those decisions, and that was not how that opportunity had been advertised to us. I think meaning for me has always been about feeling like I'm legitimately involved in that process from start to finish, and I have somewhat of a say in these decisions. I know it varies depending on the nature of the co-design co-design, the engagement process. The reason I say co-design is I know that some of my other panelists will speak to this, but I did want to quickly say that co-design is often thought about the gold standard of engagement, and it is a very valuable approach to take. But there are many ways to do good engagement, and sometimes co-design is not the right approach for whatever reason. It might be funding, it might be timing. You don't have relationships built with the individuals or communities you're looking to connect with. The type of engagement that you do should be specific to the communities you're seeking to engage with and the project or initiative at hand. An engagement that is not considered co-design can still be very meaningful, valuable, and impactful. I don't want people to draw away from doing engagement work because they don't have the capacity to incorporate a co-design process from the very beginning. All engagement practices take effort, and a really strong consultation process, let's say, that you put a lot of effort into can be far more meaningful or impactful than, in some cases, a poorly facilitated co-design process.
Yeah, it's when we had met before, one of the things that you had said, Madeline, that most stuck with me was this idea of there's a spectrum of ways of approaching this, and it's not necessarily that one is good or bad. You see, you have to find the one that's the right fit, and you have to figure out how to do it well and in a meaningful way. Carrie, did you have any thoughts on this question? What does meaningful engagement of people with lived and living experience look like?
Sure. And once again, I'll probably incorporate a little bit of my personal story, but for me, meaningful engagement involves being a part of a vision, feeling heard and being understood. I believe involving the voices of those with lived experiences allows for a wide range of people to contribute factual insight, giving an advantage to finding best solutions. It's important to learn for me, I think it's really important to learn what might not even be effective before actually trying to implement any changes. For me, knowing that eating disorders has one of the highest mortality rates of any mental illness, and that since the pandemic, there's been a significant increase. I was very thankful when the provincial government recently made it a healthcare priority in Ontario. And to better understand how to optimize access to care, improve quality, expand services, and implement solutions, there currently is a working group called the Ontario Health East Eating Disorder Working Group, which includes people with lived or living experiences. And I'm happy to say that I'm currently a part of that working group and sharing firsthand knowledge, allowing them to better understand some of the challenges that my family faced. For example, when my daughter relapsed during the pandemic, we knew she needed help, something for symptom interruption, but due to a lack of availability of resources, she continued to decline at home. Then one day she was curled up on the couch and looked at me and just said, "Mommy, I'm really scared. I feel like I'm going to die." And it's sad because, like many other families, we had to wait till she became medically unstable before we could get the intervention that she really needed. And unfortunately, this ended up leading to a 4-month admission, followed by 3 months in residential treatment. So it was like 7 months before my 14-year-old daughter came back home. So being able to share my story and engage with working groups helps highlight some of the things that they may need to focus on, like developing better ways to intervene in cases like mine, which could potentially help with other aspects as well. And possibly in our case, it could have reduced her length of stay overall and had a big impact. So from my experience so far, being on some of the working groups, engaging your participants by allowing them to ask questions, share their feedback, and be a part of the decision making are all essential parts of the process. And then I've also had people sometimes say that it's hard for them to get panelists, and I think if you can consider offering incentives to encourage people to join is kind of key. I know my daughter was very happy to engage in a couple of eating disorder studies once she was offered the choice of a few gift cards to participate for her time. So it's just something to keep in mind as well.
Great. Thanks so much, Carrie. Dean, I saw you turn your mic on, and I think you're next in the queue. Did you want to weigh in on this question of what is meaningful engagement?
Yeah, so I'm going to go in the direction of, I hear more and more the term of nothing about us without us. And I really believe in that. It kind of means that when we have conversations about people that you serve or the services that you might provide them, that they should always be part of the conversation, involved in that conversation in a way that meets them where they're at. And empowers them to participate. I've done a lot of community engagement in the area of healthcare transformation, with kind of the broader sector of community health and then mental health and addictions. And one of the older models that is often used is inform, consult, involve, collaborate, and empower. And this, I believe, leaves people in a vulnerable position of giving feedback, something that has already been decided. I think we're put in a position to react sometimes. And I want to say, in the sense, I'm an advocate for co-design, and I kind of flip that traditional kind of engagement thing to a more meet us where we're at, get us involved, and empower us to collaborate in an informed way, and then consult about solutions and experiences in the sense of looking for solutions. Co-design is for me, is having an awareness that there are different types of engagement. They're all important. One cannot replace the other in some circumstances, and some are very essential to be done concurrently and consecutively. So in the stage of healthcare transformation, in the stage of access to care, I really think that the co-design aspect begins at the start. So when providers or community agencies are brainstorming, that there is capacity there to have living experience in those conversations. And then along the way, those engagement types of processes will change. And I do think, in the sense of, in any initiative, in any project, there's different types of engagement in different situations, but some are really, they have the need to be, I want to say, concurrently done. And one can't replace the other. So I think we have to be really careful of that. And I think some of us with lived and living experience want to be part of the whole process. And that's kind of me. I want to be involved at the beginning. I want to know that the solution that has come up has been people that have experienced what I experience, have people with mental health conditions that are similar to mine, have people with healthcare navigation that is similar to mine. And I also kind of flip that I have better well-being when I'm just part of the process. And it's kind of like that coordinated care that some traditional models use. I think I'll save it there. And
Great. Dan, did you want to round up this question?
Yes, I'll try and be short. Meaningful engagement to me is when the consumer's voice is at the table, even more than just their voice, a group of the consumers that come together and put their ideas together and present them. And that's exactly what happened when we got scared during COVID.
So I can start with just a list of questions.
I'm just going to jump in really quickly and say, Camille, I think we're going to mute you. And there we go. Thank you. And sorry about that, Dan.
Okay, so,
do you want to jump in? Yeah.
When we look at the peer support guidelines, peer support is matching, formal and informal matching. And I was accepted by them. I am one of them. And for it to be peer support, you have to be one of us. There are peer supporters coming in our direction, stuff like that they've never had justice system trauma, they've never had years of homelessness, and they never had hardcore drug addiction. That's not peer support, right? That's support, though, and support is wonderful, and that's how we get well, is with support. One of those kinds of support is peer support. That's meaningful engagement when it comes to theories and ideas. When we get a group of people that have stepped out from their stigma, their marginalization, and are saying to the world, look at what's going on. We have these ideas. We need to be listened to. We see the solutions. We see how you can help us. And therefore we are trying to help ourselves by telling you how to help us. That goes against a lot of myths that they don't want help and all kinds of myths. and secondly, that everyone else has to come up for their ideas for this group. And no, we have our own ideas. Meet us where we're at. That's meet us. Our ideas are wonderful, and we proved it in St. Thomas. We asked for non-traditional housing because there was no traditional housing that would uh, be okay for us and was available for us. And that non-traditional housing was professional supports in the building. And they did that. They brought me to the mayor, and I got to tell him that. And they brought me to CCHC, and I got to tell Judith Wiley that we needed a mobile MASH unit. We needed doctors to come right to us because we can't get to the doctors. We were way too sick to get to doctor's appointments. Remember when an appointment was? And they gave us both of those things. And so 75 people are in 2 buildings that the city built for us. And Dr. Maya and his crew have been out there doing the primary care outreach, and over 100 of us have doctors and are on Sublocade. It's absolutely amazing when we are listened to. Before the Indigenous people got to have their own voice, Indian agents spoke for them. That was not helpful. When Indigenous people got their own voice, that was a wonderful change in the community. 40% of us are Indigenous and 40% are women. We all are going through those 3 traumas that and we knew what we needed, and the city gave it to us, and it worked. It's a great intervention. Supportive housing and primary care outreach were our number 1 and 2 initiatives that have saved our own lives. Thank you very much.
Thanks so much for that, Dan. We're going to pivot over to our third question, and we've got about 10 to 14 minutes to be precise for this question. But then we're hoping to open it up and take some kind of questions from the audience. And I will say that there's some great questions that have come in. One in particular that I'll just say selfishly, I'm really eager to know the answer to, but we'll jump right into our third question. So, and Carrie, I'm going to punt this one to you first. But so the question is how can we, so as individuals, as organizations, and the systems that we work within, ensure that the expertise and insights of people with lived and living experience and their support networks actually are able to help advance quality improvement and drive better outcomes in mental health and addiction services? So how do we really ensure that those voices are helping to drive quality improvement and better outcomes?
I would say for me, I think organizations need to be very open-minded, unbiased, and receptive to any feedback. I think they need to remember not to take anything personally, but more as an opportunity to do better. And again, I'll refer back to a personal experience, but I can remember a time when my child was begging for help. And even though I knew from personal experience, the emergency department wasn't always the best option for her when she was in crisis, I took her there anyway. And imagine how things went when we arrived, and before even asking her name, they asked her to step on a scale. And then after waiting for hours with my kid in distress, a nurse told me I didn't need to worry because what she was witnessing was simply attention-seeking behaviors. So, I'll refrain from my comment at that point in time. But once I had some time to calm down and better reflect, I actually sent a very professional letter to their patient relations and suggested some better education around eating disorders in their department. Unfortunately, I did receive a sympathetic phone call, and they assured me that my concern would be addressed. But in an ideal world, it would have been really nice to hear that they used my experience to focus on any small change that could have easily been implemented. So I just think it's important if people can see results. It's encouraging, and then they know that they have made an impact. When prioritizing ideas brought forward, focusing on how hard it will be to make them happen, I think it's key to give realistic goals and timelines. It's also helps to make sure everyone is cognizant of the resources, the budget, maybe some political challenges that might be barriers before you even start developing a plan. As someone who works in healthcare, I know that many times when we were struggling, it wasn't because our eating disorder team didn't want to help us. It's because they also faced their own barriers. So I think making sure your participants are informed, maybe offering alternative suggestions instead of dismissing what might be unrealistic ideas, and then start to focus on quick wins and never make promises that you can't keep. I think you just need to be transparent, build trust, and have really good communication with your panel members.
Great. Thanks so much, Carrie. Madeline, did you want to weigh in on this question? So just how can we ensure that those expertise and insights are actually driving QI and better outcomes?
Yeah, so much of what Carrie just said really resonated, and I think I'll just add on to it a little. Um, I think one of the most important things to do when you're facilitating, even planning for engagement, is considering the type of space that you are inviting folks into, and not just physical space, but mental, emotional, social, spiritual. I know one of the questions that has often been asked in spaces I've been involved in is what kind of safety do you need in this space, and how can we work to create a safe space together. Um, for example, as a queer person entering a space and immediately being misgendered is really not fun. And so having people who take the time to explore and investigate who are we inviting into the space, what do those individuals or communities possibly need, what can I do ahead of time, what can I do in collaboration with them to make sure that this is a safe space for them. Ensuring participants are on the same page about the kind of space you want to create together as well. So I'm a big fan of doing things like using group norms, or I've recently discovered discomfort agreements, where you facilitate a discussion together about what folks need from one another to be creative and courageous, and to have those difficult conversations about difficult things where perspectives might be different. Bringing your lived experience might be challenging for whatever reason. And also looking at what accountability to those norms or agreements might look like is really important. So again, I've been in spaces where I'm immediately misgendered. And one of the most meaningful things that's ever happened is after that meeting, somebody had reached out privately and asked, what is your preferred approach when somebody does that? Do you want it to be shared publicly that you were misgendered and these are your correct pronouns? Would you rather that that person be messaged privately so that it's done a little more quietly and doesn't draw any more attention to the situation? Do you prefer to take advantage of that opportunity to do so? That was really meaningful. Looking at the way that accountability within an engagement space can be done, and with compassion for all those involved. I think making engagement accessible in every sense of the word is really critical. I think if folks provide feedback, this might actually answer some of the questions that I've seen come in the Q&A box. If folks provide feedback that isn't necessarily relevant to the process or initiative that you're working on at that time, do something with that feedback anyway. I have, as a participant and a facilitator, been in a situation where the conversation veers off topic and people make such good points and share such good insights, and it just is not answering the question that we're trying to answer, or is not on topic for what we're doing together. And take that feedback down, share it with the right people who could act on it. If you have the capacity, start a new project to focus on that particular area or topic of need for those individuals and communities. All feedback is so valuable, and I don't think that any of it should fall through the cracks and get lost in translation because it just isn't the topic we're talking about. And finally, I think I would say ask the hard questions, push against the status quo. You're inviting people in to try to create change, and change isn't always easy to create, and requires courage and resilience and collaboration. You have to be willing to. One of the things that I always found really wonderful was somebody that was facilitating engagement for me in a committee I was on, was they said, I don't mind saying things that are really daunting to say in professional spaces, because it's a lot easier to say, well, this is what these people were asking for, and this is what they were saying is necessary. And I always felt like, great, lean into that courage, because it's not necessarily you having to speak on those perspectives. That's why we came together and were able to share it with somebody that we trusted would hear us out and would do their best to advocate on our behalf. It's hard to say, I don't like how you're doing something. I think you should do it differently. And so if somebody can be on your side and say, I've spoken with these folks, we've had a great conversation about this, here's their feedback, what can we do about it? Sometimes, it helps get the feedback to the right person or in the right place without too much tension or conflict.
Great. I'm interested in this idea of a comfort agreement. We might come back and hear a little bit more about that. But Dan, did you want to take a couple of minutes to chime in on this question?
Sure. To ensure the expertise and insights of the consumer, the people that you're interested in any particular work that you're doing gets through and has the most benefit. I think what happened in my case has to be repeated. Um, I got sober, and on the first day I went out there and I worked on the streets, and I did have a CMHA counselor who was well aware of my volunteering activities. And 7 years ago, he put me on a steering committee, which I got to work with top tier professionals for about 4 years. The Southwest E-QIP, wonderful E-QIP, and a couple of years after that, my addiction counselor, Addiction Services at Thames Valley, which is now with CMHA, Elgin, London, Kim. So Brian Colbeck, the first worker, he got me on the first committee. Kim got me on the second committee because they both saw me doing work in the addiction field, answering my calling and being accepted by the people out there as one of them. So we were forming groups and coming up with ideas and giving our ideas to the community. And and that really is amazing. And putting me on committees. So then my friend's voice and my voice is on the committees. I'm helping facilitate it as a peer support worker. And the top tier professionals are also partners on the committee. So we're all partners. And then I got to join Addiction Mental Health Ontario's personal lived experience, like 3 different wonderful, wonderful panels. And the best way to ensure that our insight and our expertise from the consumer of any interested, any issue, and in this case, the issue of addictions, mental health, and homelessness, it needs to come from us, not from groups that are there supporting us. That's just more service providers, and those are the top tier professionals. You can't take someone from the top tier professional, put them on the bottom tier professional, let them give all of our ideas, which aren't our ideas, but it's what they think are our ideas. Let us speak for ourselves. Let us actually be the real people. Let us work with you. And whatever mental health and all that we're going through, I have post-traumatic stress, generalized anxiety disorder, chronic pain, several addictions. But my calling is with people experiencing homelessness and mental health and addiction. And I survived after years, and it's because of the system. It's because of the super counselors. It's because I reached out. And you can see the professionals, again, this time as I got sober 7 years ago, put me on committees. I stayed out there. My friends gave me peer support. They helped me stay sober. It all works together. This whole entire community works together. We have exploded in wonderful initiatives and ideas, and the city and the county have taken our ideas and actually implemented them, and lives have been saved. We know how to save our own lives, and we know how to ask for it. We're very smart people. Let us represent ourselves. That's how you get our expertise. Pick well, and it will work. And it has been working. It's been working on all these committees, and it's just beautiful. And the supportive housing and the primary care outreach, just been. Well, my friends are ecstatic about having a home and having a doctor. Thank you.
Thanks so much, Dan. Dean, do you want to bring this question home? Do you want to jump in on this one?
Yeah, I'm going to take it in a different direction, but I really appreciate what everybody said and totally agree. And for me, it's kind of in the sense of, but we look at being equitable when people participate, and equitable is not equal for me, and it's more than cultural or authenticity. So that's really important, and we need to be aware of that. But I think one of the important parts is that while it's great to feel that you're an equal team player or you're an equal participant in a panel or a working group, I think for people with lived and living experience, to meet them at where they're at requires a little bit more equity. I might need more time. I might need to be orientated to the work. I have a slight cognitive impairment, so I need to be able to work around that. I want time to share my voice in a safe space, so that safe space looks different to different people. So I kind of want and need someone to ask me what that safe space might look like for me. And I need and kind of want to be validated in a way that shows that what I said or my point of view is heard. And that's different from being in a corporate setting or being in a setting where people are giving ideas and it's mostly providers, and then you have some lived experience. It's for me, it's different. It's an equitable kind of validation in the sense we've heard you. This is kind of how we parrot it back. Did we get it? Is this what you're saying? And I think along with that later on is the need to be debriefed after. It's like, where are you using our information and ideas and experience? How is it being used? And I think that there's an obligation when you take someone in and you put them in a vulnerable position to share our experiences can be triggering and things as we do this type of work. And the providers, they definitely go through the same thing, but it's having the capacity to check in on lived experience along the way. So it's really orientating people well, uh, bringing to the table and having a safe space to share ideas, letting people know where those ideas are going, what you're doing, and how you might be able to use them, and to check in along the way. What is this experience like for you? Do you think we're doing it right? What could we do better? What have we done well? So I think that when you're collaborating with lived and living experience, that's kind of a lens that you really need to put on all your work. And I appreciate kind of where everybody else comes from as well, using their experience to kind of demonstrate this.
Thanks so much, Dean. That's a nice way to cap off our main questions. Maybe I'll look to the panel and see. We've got a couple of minutes and we've had some really great questions come in. Are folks okay if we take a couple of questions from the chat? And one of them, Madeline, maybe you actually alluded to this in your previous comment. So if you're comfortable, maybe you can start, and then if others, want to jump in after. But because I'll say that this is one thing that I've seen that we have sometimes struggled with, and I've seen other people struggle. But so what advice does the panel have about balancing, I think, trying to have that authentic, meaningful, like gathering authentic and meaningful perspectives from people with lived and living experience, but involving people in projects where the outcomes may need to be very specific to a funder or a stakeholder needs. So we want to be authentic in gathering that feedback, but we sometimes struggle with how to use that given constraints that we might have. And Madeline, you kind of alluded to the idea that you kind of challenge people to find a way to use it, right? If not in this project, in some other way. But I don't know if you have anything to add to that.
I have so many thoughts.
Now it's when we get really spicy in the panel because we're moving into these questions. Yeah.
I will keep it brief. And I do think this is a wonderful question and something that is very realistic that so many people and organizations face. It's a legitimate experience from your end of things. There are so many barriers sometimes to facilitating meaningful engagement or engagement at all. I think this ties back to what I had said about noting down. If people are providing feedback, or if there's something that is coming up for you that's a bit of a point of tension because you can't do something with it in the particular project or work that you're doing right now, create a parking lot of ideas and return to that parking lot later. I also think something that so two thoughts. I think that I had mentioned this a bit earlier, and something that Carrie had said that stood out to me earlier as well. I think that's just be honest with people. I have very much joined engagement opportunities where I knew it was just going to be consultation. There's no power that's being disrupted in whom it gets to make what choices, but I knew that walking in, and I was able to make an informed decision about my involvement in that work. And I still enjoyed it. And it was not, it wasn't pushing any boundaries or creating any change that was like huge, but it was still an experience I enjoyed, and I still found it valuable and important to have my voice heard in that process, because even though there were, limitations to what was possible, it's still a space that I felt was worth sharing my perspectives and my ideas. And I think Carrie had mentioned earlier, providing incentives or compensation can still help to draw people to those experiences, or opportunities for engagement, even though you may not be able to provide like the best of the best engagement. Again, it still might be worth it to somebody like it was to me, and it's even more worth it when I get money to be, compensated for my time and expertise. And I think, again, I don't know what particular situations the person who asked this question is facing, but something that I always like to remind people is, when you we face a lot of no's in engagement. No, you can't do this. No, there's not enough money. No, this isn't possible. And the most meaningful and invaluable experiences that I've had both as participant and facilitator is when somebody doesn't just take that no and turn away and be like, it was a no, never mind. You explore it a little more, you try to get more information. If it truly is a barrier that you cannot overcome, get as much information as you can to tell the people that you're trying to engage with why there's that limitation. And maybe in exploring why it's a no, you might find out that there's other opportunities or ways to be creative to try to get, not a loophole, but you may not be able to do it this way. But what if you try to incorporate this, and it doesn't quite get to exactly the same thing, but there's some meaning or value in taking that alternative approach. I'll stop it there because I want to give folks a chance. But I really like this question. I think it's really relatable to so many folks, and I'm glad that it was asked.
Maybe I'll look to the panel and see if there's anyone else. Dean, one of the things that you said that stuck with me is, and I mean this in a good way, but some of this stuff is work and you really have to plan to try to do it early on. So anyway, I don't know, to the question about like, how do you strike a balance between doing meaningful engagement, but recognizing sometimes you've got constraints? Do you have any particular advice or reactions? You're
That's
smiling,
the perfect question.
Yeah.
It's the perfect question because I did look at some of the other questions in the chat, and I was going in a direction of for me, it's about co-design and it's about different types of engagement. So my kind of my experience and my way to suggest to providers and leadership is that if you don't already have an awareness to ask yourself a few simple questions when you are doing something. Have we co-designed with lived and lived experience at all levels that we can? Have we used multiple forms of engagement? Have we provided safe space? Have we acknowledged lived and living experience? Have we provided opportunity for capacity building? So in that, it's, have we developed learning tools? Have we developed lived and living experience in the work we do? Have we provided opportunity for them to take leadership opportunities? So I look at, do you have lived and living experience on your boards? Do you have advisory groups or advisory councils that meet that's lived and living experience in your everyday initiatives and not just certain initiatives? And then for me, it's it's kind of like when we look at mental health and addiction services and provider, there's a lot of you out there. There's a wide gamut. So do you share opportunities? So in a sense of participating in an event like this and seeing a panel and someone striking something that you say, I really resonate to that. It's kind of reaching out and saying, hey, you know what? I might have an opportunity for that person. Would they be interested? Or I might have, I want to I guess, develop that experience and find out something. So for me, it's just being aware, asking those basic questions. And I think for me, I lean really on co-design. I recognize there's different forms of engagement, but I think the world is changing where it really goes back to simple statements, and it's nothing about me unless I'm involved. So I don't want you talking about me. I want to be in that conversation. I want to hear it the same way. And then I want you to be able to empower me by building capacity and opportunity.
Both Dan and Carrie also kind of, I think, touched on this idea of almost like normalizing the engagement. Like Carrie, you spoke about you're part of a regular group, and Dan, you talked about other opportunities. And I think if you kind of normalize it and build it into existing structures, sometimes it makes it easier when opportunities or constraints come up. But Carrie, you came off mute. I don't know if you want to chime in.
Uh, no, I thought you were going to ask me a question, but that's okay. No, I think it just goes back to what I was saying too about implementing. Start with the stuff that you can implement with ease, right? Like there's always some stuff that you can do that you may not need the funding, or you may not need a lot of support. And if you can just start by something small and build from there, I think that's key.
Dan, did you want to jump in?
Sure. I like Carrie's idea because it's kind of like the other end of the spectrum, but going at things and grabbing the fruit that's easy to grab and all. It's great logic. With us, we went the other way, and we were going for things that are much more difficult, theoretical myths, which we say if the myths aren't true, then they're lies and false allegations against us that lead to uh, help that doesn't help, and the biggest myth right now that needs to be decided by the professionals and with our help, by our whole community, because it's not agreed upon, is whether drug addiction is a medical condition that involves mental and physical disability, or is drug addiction a choice that the person's powerful over and is responsible over a behavior. And the two different treatments, one is tough love against the behavior, and the other one, when it's a medical condition, it is completely different. If it's a medical condition that we're suffering from, that I believe we're suffering from, and I realized that from trying to get sober. I got sober 1 year, 1 year, 8 years, 8 years, and 6 years. And every time I tried to go back out to be a moderate drinker like the rest of the world. And because the one myth says that we have power and choice over usage, even if we have the medical condition called addiction. But if we've crossed the line called addiction, and it's a medical condition, and we try and cross that line, we're not going to do it successfully. We're going to fail and put ourselves right back into the palliative and critical state of dying from our addiction. If it is a mental and physical disability, which I believe it is now, and that's why I'm not going back this time, because I've had a recovery discovery. And all these documents I'm talking about, and the Homeless Coalition of St. Thomas, we have an email, and it's on the board there, thcofst@gmail.com. And I'll send you these stories, and help continue this conversation. But Charter Rights and Freedoms, Section 15.1, has a list of areas that people need protected against discrimination. And the last two on the list are mental or physical disability. If addiction is mental and physical disability, which I believe it is, and a medical condition, then I can't overcome it. It's going to be with me forever, and I'm going to need an awful lot of support to be one of the ones that survive it. I think it's with me for life, just like an allergy would be with me for life. And I never knew that before. I learned that this time around. And I've taught that to people out there on the streets, and they're going, wow, that makes a lot more sense. If it is a discrimination because the stigma we're facing is because of a medical condition, mental and physical disability, Charter 15.1 is engaged. And that also engages the Human Rights Code of Canada because it affects our housing. This is a huge issue and needs to be straightened out. If it is medical and we have stigma due to medical and affects our housing, Canadian Charter Rights and Freedoms and the Human Rights Code need to be engaged to help us and to help us get into supportive housing. Thank you very much.
Thanks so much for that, Dan. We are just under the wire, and we've had some great questions that have come in that we haven't had a chance to get to. I will say that we've got a few folks in the questions who are asking things like, how do I change the rules of the game? How do I get into spaces? Or how do we welcome people with lived and living experience into spaces that perhaps they haven't been before? I think the conversation today has inspired a lot of people to think about this a bit differently. I'll just say personally, again, I had a chance to chat with these folks before, but this idea of people bringing a sense of curiosity, a sense of innovation, a different way of thinking about issues, the practical tips around how do you debrief with people and really be clear about, I think this sort of like honest upfront, what are you looking for? And then how do you let people know what you've done with that? I think also the other one that really struck me is this idea of really, in some ways, it's just really about authentically listening. It's listening. It's asking a question and really caring about what the response is. And then also kind of building up capacity for people to really be able to engage and translate those experiences and perspectives into change within the system. So I'll just say a personal thank you to everyone on the panel. And I'll say thank you as well on behalf of all the participants. Thank you to the participants as well for joining us. This has been a great discussion. And I think, Eleni, I'm going to turn it over to you. Thanks so much. And thanks so much, Dean and Madeline and Dan and Carrie for joining us for this panel.
What a great discussion. Thank you to our panelists for sharing your insights and expertise with us today. That was wonderful. And of course, a big shout out to Danielle for moderating the discussion and our audience for your engaging questions. It is now my pleasure to introduce Graham Woodward, Vice President at the Mental Health and Addiction Center of Excellence in Ontario Health, to begin our closing ceremonies for today's program. Graham has focused his career on improving healthcare policy, planning, and delivery through the better use of evidence, data, and collaboration. In his role at the Center of Excellence, Graham's focus is on creating a high-performing mental health and addiction system that delivers improvements in outcomes and experience for Ontarians. Prior to joining the Center of Excellence, Graham held leadership roles across the healthcare system. He co-led the merger of the Cardiac Care Network and the Ontario Stroke Network to create Core Health Ontario, where he led the health system policy, planning, and performance portfolio. Lots of P's. Graham also held leadership roles at the Ontario Renal Network, Cancer Care Ontario, and the Ontario Ministry of Health, as well as research positions in the Institute for Clinical Evaluative Sciences and the University of Toronto. Graham, thank you for being here with us today.
Thanks, Eleni, and sorry for such a long introduction. I will shorten that one up next time. I didn't realize you had to read it all. All right, so thanks so much for inviting me to speak, and thanks for a wonderful event. I'm not going to use up all the time allotted to me, which you're probably thankful for, but I just want to take a few minutes to reflect and offer some thanks. So I hope you all enjoyed the event as much as I have, from the start with Camille, Anna, and Ben, to the end where we focused on people with lived experience. It was a bit nostalgic for me listening to the opening speakers. I first worked with Ben in 2002. At that time, I was helping Ben with physician resource planning, predicting the number of physicians we would need today. I don't know how successful we were with that endeavor, but it was a wonderful example for me on how data and strong trusted relationships among providers and policymakers could drive system change. It was a true collaborative process, resulting in a new Northern Medical School, revised medical enrollments, and an entire unit within the Ministry of Health focused on health human resources planning. Unfortunately, as with a lot of policy work, the details of this are not captured in a report or publication, but it's an experience I'm sure many of you are familiar with. I initially worked with Anna back in 2006 at the fledgling Cancer Care Ontario, where we were helping build a foundation to the cancer system we know today. Anna was the director of the Health Quality Council, and I was the director of the provincial planning. Our job was an extension of what I had learned working with Ben, essentially using data to engage providers and policymakers about a better system. I have known Camille for only a couple of years, but I very much appreciate the commitment she and her provincial leadership team have demonstrated to this approach. Our progress towards a standardized provincial data set is in no small part due to the CMHA leadership across the province. I joined the Center of Excellence about 2.5 years ago, and my job at the center is essentially the same as my time with Anna and Ben 20 years ago. It's using data to engage providers and policymakers on a journey of system improvement. We have improved this process by including persons with lived experience, many of whom we just heard from recently, but the general approach remains the same. The challenge is we don't have great data in this sector, something we're aiming to improve. The sector is broad and diverse, making comprehensive engagement difficult, and the policymakers are spread across multiple ministries and divisions within those ministries. In spite of this, I've seen considerable progress building the foundation for a better system of mental health and addictions care, thanks to people like yourselves. System leaders who understand the value of data and the need to standardize care according to the evidence. People who want value transparent engagement and measurement and the sharing of lessons learned. I saw evidence of this today in the sessions I was able to attend. Together, we have a very ambitious agenda for change that will require continual effort and a culture of transparency, trust, and measurement at both the system and provider level. Going into this new fiscal year, I am more optimistic than I've ever been that the system we all want for clients and providers is achievable. Events like today further heighten my optimism. But as Ben stressed at the start of today, we need to remain focused and do the basics very well. We need to make it evidence and data-driven, make it measurable, make it transparent, and make it sustainable. Thank you for taking time away from your busy schedules to join us today and to show a commitment to continual improvement in the mental health and addiction sector. Thanks to the presenters for sharing what worked and, as importantly, what didn't work. Such engagement is necessary for us to ultimately agree on what working well actually means to us and looks like to our sector. In other words, what does good care look like and what's a good outcome? Have a great evening, and hopefully I'll see many of you again much sooner than next year.
Thank you, Graham. What a wonderful and informative day we have all shared. Just to recap, our keynote speaker, Dr. Ben Chan, spoke to us about the joys and opportunities in QI. Anna Greenberg effectively highlighted the importance of equity and quality improvement during her address. Our numerous concurrent session presentations and panel discussion provided insights and kept us engaged throughout the day. And of course, Graham's closing remarks helped to connect all of today's speakers and topics of discussions and left us with a message of hope. Our hope is that you leave today's conference inspired and energized to advance and enhance efforts to build a culture of quality within your organizations. A few last housekeeping items from me before we officially end for the day. We encourage everyone to take a few minutes to complete the conference evaluation by clicking the evaluations icon on your homepage. Your feedback is much appreciated and used to inform planning of future events, such as today's conference. By completing the evaluation, you are automatically entered into a draw for a chance to win a $25 gift card from Indigo. Also, a reminder that recordings of today's events, including our keynote speaker, panel discussion, and concurrent sessions, will be available to all conference registrants for 90 days on the conference platform. I would like to take a few moments to thank the many people that helped make today's event a success. Thank you to all of our speakers and executive sponsors. Thank you to the authors of the poster presentations, moderators, our ASL interpreters, and of course, all of you, our conference participants, for making today such a success. Special thanks to Ash Coster, Olivia Condlin, Sherry Sims, and Mary Ioannidis, and the rest of the conference planning committee for the months of work that went into planning today's event. And lastly, thank you to the Ministry of Health for continued funding of the conference partners. It's been my pleasure to host today's event, and I wish everyone a wonderful evening.